key phrase that you have to kind of note when you're reading science books. What Anderson does not address is the consistent findings throughout every variant of COVID-19 around the world in science reports. The clinical finding that there had been no wider community spread outside these large social gatherings and had been observed at Cornell University, very elite Ivy League college in New York, with reports of infections only on campus, but not the surrounding town and outlying counties. And even during the outbreak at Provincetown in July 2021, where over 1,000 fully vaccinated gay men had increased the pandemic vocabulary of most Americans, adding to the lexicon the phrase breakthrough infection. A month before the Pfizer COVID-19 countermeasures, or some say vaccines, had been approved for release for licensed marketing by the FDA, which signal from the FTC gave many assurance to take these products. Like the term lack of insight. This breakthrough infections, not so much, but more this lack of wider community spread is a significant finding in psychology for at least civil commitment proceedings. The clinical finding of no wider community spread suggests that a transmission of a disease is most likely associated with a location as a dependent variable. Yes. Reducing gatherings to the status of a dependent variable. Simply stated, large gatherings will not be infected if they avoid that location, because getting the virus is a function of coming into contact with the virus, how much is being shed, and how long a person is exposed. Still ignoring this limitation to his findings and conclusions, Anderson proposed that because more than 1 million people from all over the U.S. were drawn to the Mardi Gras parade in New Orleans, starting on February 14th, and culminating on February 25th, 2020, Mardi Gras Day or Fat Tuesday, it must necessarily follow that the timing and the scale of this event, as well as the absence of any meaningful mitigation efforts in agreement with official guidelines at the time, provides a unique opportunity to investigate how large-scale events can accelerate SARS-CoV-2 transmissions and amplify local outbreaks during the ongoing pandemic. Clearly, to any critical reader, this is only wild speculation and not a statement of fact rooted in the science. We all have our own degrees of familiarity with science, even after 4 years of pandemic. Of most significance to a forensic investigator looking at these types of outbreaks was Anderson's reports based upon the sequencing of the genome, where in Louisiana, the chances of getting infected in places like Shreveport, where, according to Anderson, SARS-CoV-2 emerged noticeably later than New Orleans after Mardi Gras on March 17th, and a location associated with the deaths of almost 30 Pentecostal faith leaders who had visited that city on March 7th, 10 days before, were actually lower than being involved in just an automobile accident, a little fender bender. But instead they caught COVID-19 and died before Easter because they had found that SARS-CoV-2 in Louisiana displayed little genetic diversity compared to other states and was likely introduced from a domestic source, not coming in from China, not coming in even from other states. What Anderson suggests is that there was something different in Louisiana when comparing a mixture of unique genome sequences, very much like measuring ballistics on a bullet, that had been found in other states, making that location unique as an outlier that apparently had not been altered by the Mardi Gras introduction of over 1 million visitors from around the United States, which would have reasonably been expected to introduce new variations on the genome level associated with other locations. But significantly, that did not somehow occur. which should make you at least scratch your head if you're following the science. And accordingly, Anderson concludes that 1 million people arrived in Louisiana from around the United States, COVID-19 free, generally, and were somehow infected there and started passing on with this unique Cajun style coronavirus in Big East. A reasonable person might ask how that might have been even possible. But of course, pandemics and epidemics are times historically associated with fear, confusion, and despair, and people just do whatever they're told to do, just to try to do something. The first reported case of COVID-19 in Louisiana was detected on March 9th, 2020. Dates are very, very important when you're looking at these things as an investigator. Almost 2 weeks of the early prescribed quarantine period after Fat Tuesday in New Orleans. It has been well established by Ben Killingsley that persons infected with COVID-19, at least the first variant, should develop symptomatic presentations of illness distinct from asymptomatic signs like coughing and sneezing within only just 4 days if they are infected at all. Symptoms of COVID-19 infection include fever or chills, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, and sore throat. And despite news regarding an approaching pandemic, at least according to Anderson's report, these rather distressing symptoms, not just asymptomatic signs of coughing and sneezing, these distressing symptoms in Louisiana had gone largely undetected due to inadequate testing. Apparently, when people in Louisiana get that sick, they just kind of stay away from doctors, even before pandemic. And somehow in Louisiana, for unknown reasons, based upon the science, the epidemic rapidly increased, with reported cases reaching a peak on April 4th. How is that possible? What are the odds? A unique mixture of virus, unique to the Bayou State, 2 months after the introduction of COVID-19 to the United States and unchanged by the arrival of over 1 million visitors for Mardi Gras, where Anderson assumes that these wide-scale infections resulted in cases that would not appear to begin until 2 weeks after Fat Tuesday, and then not escalate until April 4th, just out of nowhere, if the aliens came down and gave us COVID-19. Going largely undetected, a silent killer lurking in the shadows until suddenly becoming hyperactive for no known reason or explainable to some. According to Anderson, the source of many other local epidemics in the U.S., including the one in Louisiana, is unknown and remains unknown. However, according to this scientific report, published in mid-September 2021, over a year after the event, Anderson had presented several lines of evidence showing that it is likely that the Mardi Gras Festival in New Orleans was a super-spreading event. One, an unusual lack of genetic diversity of SARS-CoV-2 in Louisiana, which in sharp contrast with what has been seen in other large U.S. cities and more similar to what has been observed during cruise ship outbreaks. Two, although our analyses suggest that SARS-CoV-2 was likely transmitting locally before Mardi Gras, we found that it is unlikely that the observed epidemiological curve in New Orleans could have been recapitulated without super spreading during Mardi Gras. 3. Infection rates in New Orleans in the weeks immediately following Mardi Gras were substantially higher than in other major cities throughout the U.S. And for the growth rate of lineages falling within Louisiana clade was close to the highly transmissible B117 variant, suggesting highly favorable epidemiological circumstances. This message was approved by Major Mike Webb. This has been a Filmways presentation, darling. And y'all go back now. You. Honest.